From aspirin to antibodies, medicine have shaped the way we live, heal, and thrive. But have you ever wondered how they actually work? Welcome to MS Pharmacology. Today, we are diving into one of the most exciting and essential fields in medicine, that's pharmacology. In this video, we will explore what pharmacology is and take a closer look at its major divisions. Before we begin, let's start with a simple but fundamental question. What is a drug? When you hear the word drug, what comes to your mind? Maybe your medicine cabinet, a hospital, or even a pharmacy? But drugs go beyond just medicine. They include anything that can change how our body functions both physically and mentally. From the coffee that wakes us up in the morning to the painkiller that soothes a headache, drugs are everywhere. Some help us to heal, others can be used for recreation, and some are even tools for research. So let's buckle up and explore the world of pharmacology. So let's see the definition for drug. It is a substance that causes a change in physiological or psychological functions in the body. Or a drug is any chemical substance or product that is used or intended to be used to modify or to explore physiological systems or pathological systems or pathological states for the benefit of recipient. So in simpler terms, it's any chemical substance that affects how our body operates. Now let's see, why do people use drugs? There are several main reasons why people take drugs. Let's break them down. First one is therapeutic use. This is the most common reason to treat illness and medical conditions. Think of drugs as little superheroes inside your bodies. Got a fever? Paracetamol steps in to cool you down. Got a bacterial infection? Antibiotics rush in to fight off the invaders. Next one is recreational use. Some drugs are taken purely for enjoyment, like caffeine in coffee, nicotine in cigarettes, or alcohol at a party. These substances can change mood, energy levels, or even perception. Now, the third one is research and diagnostic use. Scientists use drugs to understand diseases and develop new treatments. Some are used in medical imaging to help doctors to see inside the body, while others help researchers explore biological processes. Now that we have covered why people use drugs, now let's get into the heart of our discussion, pharmacology. What is pharmacology? It is a science that deals with the effects of drugs on the function of living system. In simpler way, we can say it is a study of how drugs interact with a living organism. It helps us to understand how drugs work, how they move through our bodies, and how they can be used safely and effectively. We'll dissect the key aspects of drug action from interactions and mechanism of actions, therapeutic uses, dosages, and potential side effects. Pharmacology is like the ultimate user manual for drugs. It answers questions like how do drugs work, where do they go in the body, how can we use them safely and effectively. Now let's see what are the key aspects of drug action. Let's break down the how and why of the drug action. First one is mechanism of action. This is the how. How does the drug actually work? Does it block a receptor, stimulate an enzyme, replace a missing hormone? For example, aspirin works by blocking an enzyme called COX, which reduces inflammation and pain. Now, second one is therapeutic uses. This is the why. What condition is the drug treating? For example, insulin is used to manage diabetes by lowering blood sugar levels. Now, third one is dosages. This is the how much. Getting the dose right is very essential. Too little and the drug won't work. Too much and it could be a toxic. Now, next one is side effect. Every drug has a flip side. For example, chemotherapy kills cancer cells but can also damage healthy cells, causing side effects like hair loss and nausea. Pharmacology has several key divisions, and today we'll explore each of them in an engaging way. So let's start with pharmacokinetics. So what does pharmacokinetics mean? It's essentially the study of what the body does to the drug. So, this includes how a drug is absorbed, distributed, metabolized, and excreted, that is ADME. Let's begin with absorption. Absorption is the process by which a drug enters the bloodstream from its site of administration. It is a crucial step in pharmacokinetics, influencing the onset, intensity, and duration of a drug's effect. Several factors affect absorption, including the drug's formulation, the route of administration, solubility, and the presence of food in the gastrointestinal tract. Next, we have distribution. Once a drug is absorbed, it circulates through the bloodstream and is distributed to various tissues. Several factors affect this process, such as blood flow and the drug's ability to cross barriers like the blood brain barrier. Understanding this aspect is essential for determining how effectively a drug reaches its target site. Moving on to metabolism, which primarily occurs in the liver. This process involves the transformation of drugs into more water soluble compounds that can be easily excreted. Notably, some drugs may be converted into their active forms while others are deactivated. This aspect has significant implications for a drug's therapeutic effectiveness. The final step in pharmacokinetics is excretion. This is the elimination of drugs from the body, primarily through urine or feces, but also via breath and sweat. The efficiency of excretion is crucial for maintaining drug levels within the therapeutic range, ensuring safety and effectiveness. So, pharmacokinetics is all about the ADME adventure, how a drug gets in, gets around, gets changed, and gets out. It's the ultimate roadmap for understanding how drugs move through your body. Now, let's transition to pharmacodynamics, which focuses on what drugs do to the body. Our cells are covered with proteins called receptors. These receptors are like tiny locks waiting for the right key to unlock them and trigger a response. Think of a drug molecule as a key. It has a specific shape that allows it to bind to a particular receptor, like a key fitting into a specific lock. For example, painkillers like morphine alter pain perception, while antidepressants increase neurotransmitters in the brain that support mood elevation. Understanding these interactions helps in predicting drug actions and optimizing treat regimens. Next, we have toxicology. This vital area investigates the harmful effects of substances, including drugs. Toxicology at its core is the study of the adverse effects of chemical, physical, or biological agents on living organisms. Notice I said adverse effects. This is crucial. Even seemingly harmless substances can be toxic in excessive amounts. Conversely, substances we consider poisons can have therapeutic effects at low doses. The route of exposure can significantly influence the speed, the severity of the toxic effect. For example, inhaled toxins often act more quickly than ingested ones. Psychologists study how overdose can lead to adverse health outcomes, crucial in developing antidotes and managing poisoning cases to ensure safe drug use. Now let's look at neuropharmacology, which explores how drugs influence brain function and the nervous system. Neuropharmacology is particularly crucial for treating mental health conditions. These disorders often involve imbalances in neurotransmitter systems. Take depression, for example, a condition that can feel like a heavy cloud hanging over a person's life. Research shows it often stems from a drop in essential neurotransmitters like serotonin, norepinephrine, and dopamine. Fortunately, there's hope. Medications such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and monoamine oxidase inhibitors act like little mood lifters. They work diligently in the background, boosting the availability of these mood enhancing neurotransmitters in our brain. Now, let's switch gears to anxiety disorders, where the narrative changes a bit. Here, GABA, the brain's natural calming effect, plays a starring role. When the balance is off, anxiety can spiral out of control. That's where anxiolytic comes in. Medications like benzodiazepines enhance GABA's calming effect, offering a soothing embrace to the nervous system and providing a powerful antidote to the chaos of anxiety. Next, moving on to cardiovascular pharmacology. It is a study of the effects of drugs on the cardiovascular system, which focuses on medications that treat heart diseases. Here we see beta blockers. These drugs work by blocking beta adrenergic receptors, which are found in the heart. These receptors are normally stimulated by adrenaline, which increases heart rate and force of contraction. By blocking these receptors, beta blockers reduce heart rate and blood pressure, making the heart work less. Next, we will discuss ACE inhibitors or angiotensin converting enzyme inhibitors. These drugs target the renin angiotensin aldosterone system, a hormonal system that plays a key role in regulating blood pressure. ACE inhibitors block the conversion of angiotensin 1 to angiotensin 2, a substance that narrows blood vessels. By doing so, they relax blood vessels, lowering blood pressure. Next one is gastrointestinal pharmacology. It is a study of the effects of drugs on the gastrointestinal tract. So, this field addresses various digestive system disorders. Let's consider a common problem like heartburn or acid reflux. This occurs when stomach acid flows back into the esophagus and causing a burning sensation. Antacids are a common remedy for heartburn. They work by neutralizing stomach acid, providing quick relief. However, they generally offer short term relief and aren't suitable for chronic issues. For more persistent acid reflux or conditions like GERD, we turn to proton pump inhibitors or PPIs. These drugs work by reducing the production of acid in the stomach and providing longer lasting relief. Next, we have immunopharmacology. It is a study of the effects of drugs on the immune system. So, this field studies how drugs can modulate the immune responses, like a conductor leading an orchestra. Immunopharmacology modulates the immune system's performance, ensuring all its components play together in harmony. Vaccines are a prime example of immunopharmacology in action. They work by introducing a weakened or inactive form of a pathogen to the body. This exposure stimulates our immune system to produce antibodies and develop immunity, so that if we encounter the actual pathogen in the future, our bodies are primed to fight it off effectively. However, immunopharmacology isn't just about stimulating the immune system, it also involves suppressing it. Immunosuppressant drugs are used to treat autoimmune diseases where the immune system mistakenly attacks the body's own tissues. These drugs are also crucial in organ transplantation to prevent rejection of the donated organ. Beyond vaccines and immunosuppressants, there are other types of immunomodulatory drugs. These drugs can fine tune the immune responses in various ways, for example, by boosting specific immune cells or blocking inflammatory pathways. Next, we have respiratory pharmacology. It is a study of the effects of drugs on the respiratory system. This field is essential for treating respiratory conditions and enhancing breathing effectiveness. Inhalers are a cornerstone of respiratory treatment. They deliver medications directly into the lungs, providing rapid and localized relief. This direct delivery minimizes systemic side effects compared to oral medications. Now, bronchodilators are a class of drugs that relax the bronchial smooth muscles, widening the airways. This is important in conditions like asthma, where bronchospasm causes wheezing and shortness of breath. Inflammation is a key component of many respiratory diseases, including asthma and COPD. Anti inflammatory medications work by reducing this inflammation in the airways. Allergic reactions also can trigger respiratory symptoms such as sneezing, runny nose, and inflammation in the airways. So, here antihistamines work by blocking histamine receptors, reducing the effects of histamine, a chemical which is released during allergic conditions. Hence, understanding these medications is essential for managing a range of respiratory conditions including asthma, COPD, and allergic rhinitis. Next one is endocrine pharmacology. This is a study of the effects of drugs on the endocrine system and hormone function. So this branch of pharmacology focuses on drugs that regulate hormone levels in the body, which is essential for maintaining homeostasis and treating various endocrine disorders. Hormones are chemical messengers that play a critical role in regulating processes like metabolism, growth, reproduction, and energy balance. A prime example is insulin therapy. One of the most well known applications of endocrine pharmacology is insulin therapy, which is critical for individuals with diabetes. Additionally, medications influencing thyroid hormones are necessary for managing conditions like hypothyroidism and hyperthyroidism, helping to regulate metabolism and energy levels. Next one is biochemical pharmacology. It is a branch of pharmacology that studies the molecular and biochemical mechanisms of drug action, including how drugs interact with enzymes, biochemical pathways, and metabolic processes within the cells. So, this field studies how drugs interact with enzymes, receptors, and other cellular molecules. It helps us to understand why some drugs work so well, why others cause side effects, and how we can develop even better treatments. This field is vital for understanding how cancer therapies can target malignant cells effectively while minimizing damage to healthy tissues. So, by examining these molecular interactions, researchers strive to develop treatments that enhance their efficacy and reduce side effects. Okay, friends, so far we have explored how drugs work in the body from pharmacokinetics and pharmacodynamics to their impact on the nervous, cardiovascular, and immune systems. So, in part 2, we'll dive into cutting edge topics like pharmacogenomics, chemotherapy, clinical toxicology, and even the future of personalized medicines. Trust me, you don't want to miss it. If you found this helpful, don't forget to like, share, and subscribe so you will be notified when part 2 drops. Also, let me know in the comments what topic you are most excited about. Thanks for watching, and I'll see you in part 2 where we take pharmacology to the next level. Okay, bye bye.